good evening. Welcome to Easy Nurse, where the nursing education made easy. So tomorrow is your exam. Are you worried about your exam? Don't worry, we are here for you. So today we will discuss about some important questions from our nursing foundation and first aid. So let's start. So first, before that, we want to tell all the questions of our question paper. So first we having give the meaning of the following. It contains 4 words. In that we want to write the meaning. The next one is filling the blanks. In this filling the blanks, it's also contain the four questions. In that fill in the blanks, we want to answer the following. The next one, write the short notes for the following. It also contains the 4. The next one is answer the following. It also contains the 4. The next one is true or false. It also contains the 4. But if the answer is false, means you want to correct it and write the answer. Okay. Next one is short notes. In that also we contain only 3 questions. The last one is answer the following, and it is having 4 questions. So this is our question pattern. Now we are discussing one by one. So let's move. Don't make tension. Be cool, and we can answer the all questions. Okay. So first one is give the meaning of the following. So first one is define health. What is health? Health is a complete physical, mental, social well-being, not merely the absence of disease, infirmity. This words by WHO, World Health Organization, in 1948. What is the meaning of health? It is physical, mental and social well-being. The 3 things. What all are this? Please try to say along with me: physical, mental and social well-being, and not merely the absence of disease or infirmity. So here we are completing our first answer. Next we are moving for the second one, nosocomial infection. What is nosocomial infection? It is also known as hospital acquired infection. What is it also called? It's also called as hospital acquired infection. These are the infection that occurs 48 hours or more after a hospital admission, which were not present or incubating at the time of admission. What is this meaning? Because if the patient is admitted in the hospital with a surgery case, the person or the victim 2 or 3 days he got a fever, a newly come disease. So it comes from the hospital. So it is known as nosocomial. The second infection that comes from the hospital. So we having 3 examples in the nosocomial infection. First one is urinary tract infections from the catheter use, pneumonia from ventilators, and third one is surgical site. So this is the second one. The next we are moving for the third one, embalming. So what is embalming? Embalming is the process of preserving dead body to delay decomposition. What is that? Preserving a dead body to delay decomposition, typically by injecting chemical solutions like formaldehyde into the blood vessels. What do you mean by this one? Because if the person is died and if their close relatives were in abroad, 2 or 3 days only they will come back, means the dead body or the body don't want to delay the decomposition. So that's why we are injecting some chemical compositions like formaldehyde. So that's why it will not decompose, it will delay the decomposition. So what are the 3 purposes of embalming? What is the 3 purposes? Preservation of viewing or funeral, sanitation or restoration of natural appearance. So this is known as embalming. So next we are moving for the 4th question, pulse. We already know that pulse is one of the vital signs. So what is pulse? Pulse is the rhythmic expansion and contraction of an artery as blood is forced through it by a heart contraction. It reflects the heart rate and rhythm. Pulse, we all understand that heart is pumping the blood. So in that rhythmic expansion and the contraction of the artery is known as pulse. That rhythmic expansion is known as pulse. Okay, we have, it is an important thing. What is the normal range of the, what is the normal pulse rate? What is the normal pulse rate? It is the 600 to 800 beats per minute. What is that? 600 to 800 beats per minute. It is very important, or it will ask for the one word question, 60 to 100 beats per minute. What is the pulse rate? Okay, next we were discussing about the common pulse rate. What are the common pulse rate? Normally we are checking pulse rate in the radial. Okay, in this way we were checking the pulse. Okay, that is radial, it is wrist. Radial, that is wrist. Next one is carotid, that we are checking in the neck. What is that? Carotid. Please try to say with me, carotid, it is neck. The next one is brachial. Brachial, it is an arm. Next one is femoral, that is groin. Groin region, we can see the pulse. Okay, next we are moving for the next question. Next we are moving for the next segment, that is fill the blanks. In this fill the blanks also we contain the 4 things. So first we are moving for the 5th one. Inflammation of gum is known as dash. What is inflammation of gum? Gum, we all know that in our mouth area the gum is there. What is called inflammation of gum is known as dash. That is gingivitis. What is that? Gingivitis. Then next one is 6th one, the term used for difficulty in breathing. What is that? Difficulty in breathing. Please note, difficulty in breathing, that is dyspnea. What is that? Dyspnea. In the case of, if they are asking the term used for absence of breath means that will be the apnea. Okay, that will be apnea. So absence A and apnea A. In difficulty D, this is dyspnea D. Okay, that is the term used for difficulty in breathing, that is dyspnea. Understood? No? Next we are moving for the 7th one. Gesture is an example of dash. What do you mean by gesture? Gesture means the action. We are making an action and we are making to understand others. That is gesture. So gesture is an example for non-verbal communication. In there no communication is going on. Only the actions were going on. So that's why that is known as gestures is an example of non-verbal communication. Okay, next we are moving for the last of our fill in the blanks. The best method of disposal of waste is. What is the best method of disposal of waste is incineration. What is that? Incineration. It is a type of biomedical waste management. So here we are completing our 4 fill in the blanks. Next we are moving for the write the short notes for the following. Short notes. So the 9th question we are moving for the list the golden rules of first aid. What all are the golden rules of the first aid? So here we having, first one is do not panic, ensure safety first, check for the response. The next one is call for help, check airway breathing and circulation. Next one is stop bleeding, and next one is don't move the victim unnecessarily. Next one is give reassurance and comfort. Next one is avoid giving food or drink. The next one is use first aid kit is available. So what is that? So do not panic. What is that? Do not panic. Stay calm and think clearly what you want to do. Then you want to make a confidence and reassure the victim and assure the victim. So don't become panic. If we also panic means the victim also will be panicked. Then it will be very worse situation it will be. So don't become panic. Okay, next will be ensure the safety first. First we want to make our safety ours and the victim. So check the sense of danger. If there any danger, you must watch. If there any danger, if fire or traffic or electric wires, if there are any signs of danger, you must see before approaching to the victim. Okay, next one is check for the response. Response you want to check. What? Gently tap. If the check the response means if the victim is there, we want to go, we want to approach the victim. Then we want to see whether the patient is conscious or not. If the patient is conscious means just gently tap. Then we can ask the patient, are you okay? Are you okay? Like that we can ask. So gently tap and ask if the person is okay, as is conscious or not. So next one is call for help. So in our India, it is an emergency number is 108. So we can immediately call the fire station or the ambulance immediately. Then check the airway, breathing and circulation. It is of A, B, C. Airway, breathing and circulation. And we must check the airway, ensure it's clear airway or not. The next one is breathing, look, listen and feel for breathe. We want to check whether the victim is having breath or not. Next one is circulation. How we will check the circulation? By checking the pulse. Okay, check for a pulse or signs of blood flow. So in this way we can check airway, breathing and circulation. Next next thing is stop bleeding. If apply firm pressure with clean cloth to control bleeding. If the victim having bleeding, means we can apply some pressure and control the bleeding. Do not move the victim unnecessarily. If the patient having any fracture or spinal injuries, we are moving for unnecessarily, it will cause major damage. So unnecessarily don't want to move. Okay, next one is give reassurance and comfort. What is give reassurance and comfort? Keep the person warm and stay with them until help arrives. Okay. Next one is avoid giving food or drink, especially if surgery may be needed or if the person is unconscious. Then use first aid kit is available. Always use clean and sterile materials to prevent the infection. So this is only about that 9th question. Next we are moving for the 10th one, principles of bed making. So there are mainly this all types of bed principles are there. That is cleanness, comfort, safety, body mechanics, systematic approach, time and material economy, neat appearance, patient condition. This all are the main purposes. Then we can discuss one by one. What is cleanness? Cleanness, use clean, dry and wrinkle-free linen to prevent infection. In mainly, if there is no cleanness, there is main chance to get the infection. So to prevent infection, we should be maintain cleanness. Okay, next one is comfort. Ensure patient comfort and prevent bed sore. Next one is safety. Secure linens properly, avoid flaws and cirrus. Okay, next one is body mechanics. What is that? It is the use of correct posture to avoid stain. Use a good body mechanics to avoid the posture. Okay, to avoid the strain for the postures. Okay, next one is systematic approach. Work from one side in one order. The next one is time and material economy. Use only needed items efficiently. Okay, the next one is neat appearance. Bed should look clean, tight and inviting. In the neat appearance only, the patients will attract the bed. So the bed should look clean, tight and inviting. The patient condition. What about the patient condition? Adjust the bed type as per patient needed. If the patient need to have the food, we want to make the patient in a semi-fowler's position. So like these positions we are maintained by the patient condition. So next we are moving for the 11th question. Explain about the under 5 clinics. What is under 5 clinic? Under 5 clinics are special health services provided to monitor, protect and promote the health and development of children under the 5 years of age. Under 5 clinics mainly we are focusing about the children who are under 5. We want to protect and monitor and promote their health. Then only, because their immunity will be very low. So we are focusing about the under 5 clinics. So now we are discussing about the functions. So here are the functions: growth monitoring, regular weight and height checking using growth charts, immunization. Next function is immunization. According to National Immunization Schedule, BCG, Bacillus Cumulative Urine, DPT, diphtheria, tetanus and OPV, oral polio vaccine. Like this immunization we should give for the children. Okay, next one is check health checkups. What is health checkups? Screening for malnutrition, anemia and infection. Diphtheria, pertussis and tetanus, that is DPT, sorry for that. Okay, next one is treatment of monitoring alignments. What is that? Treatment of monitoring alignments like diarrhea, fever and respiratory infections. Okay, next one is nutrition advice. What we are giving nutrition advice? Breastfeeding, weaning, because it is under 5 children, so breastfeeding will be there one in the age of 1 or 2. Okay, before month also we were considering under 5 children, so breastfeeding, weaning and complementary feeding. Then health education we want to give. Where we want to give health education? For the mothers only we will give the other health education. On hygiene, sanitation and accident prevention we will give the health education. The parental counseling we were giving for early simulation and development. Okay, so this is our 11th question. Next we are moving for the 12th one. Write about the dimensions of health. What all are the dimensions of health? So we having seven dimensions of health is there. Okay, first one is physical health. What is physical health? Proper body functions, absence of disease, fitness and nutrition. That is physical health. Whether we are checking physically health means it is if the person is not having the disease, they must be the fitness, and they must be having a proper nutrition also. Okay, next one is mental health. What is mental health? It is the ability to think clearly, manage emotions, handle stress. These all persons we can tell that it is a mentally healthy person. Next one is social health. What is social health? Maintaining healthy relationships and effective communication. If how we will tell if the person is socially okay, that means if the relationships are good, then they are communicating good manners, like that we can tell that it is socially healthy person. Then next one is emotional health. How we will tell the emotional health? Awareness and control of feelings, coping the life events. Next one is spiritual health. What is spiritual health? Sense of purposes, values, beliefs and inner peace. That is known as spiritual health. Next one is environmental health. Environmental health means safe surroundings, clean air, water and healthy living condition. This all in the surroundings must be clean, and the clean air should breathe, and water should be clean, and they will be a healthy living condition. This all considered as environmental healthy person. Next one is the last point, occupational health. What is occupational health? Satisfaction and well-being in work life. If the occupation, their work should be good, that's why we can tell the person is occupationally health. So this all are the 7 dimensions of health. So next we are moving for the next section. Answer the following. What is first? The first question is define hygiene. What is what is hygiene? We all know that what is hygiene. Hygiene is the science and practice of maintaining health and preventing disease through cleanliness. Through the cleanliness only. Through the cleanliness, and one more thing, the sanitary measures in a personal. In the sanitary measures, like this only, through the cleanliness and sanitary measures, that we can know whether the person is hygiene or not. In which all ways we were checking? In personal way, environmental way and public settings. In 3 things we were checking whether the patient is hygiene or not. It includes the practice like bathing, hand washing, oral care, clean clothing and safe food handling. These all are the practices we were daily doing for the hygiene. Next we are moving for the 14th question. Explain the factors influencing to maintain promotion of health. What are the factors? So here are the factors. First factor is genetic factors. It is an inherited conditions and family history. It is the first factor, it is genetics. Then second one is environment. Environment, we can say clean air, water, sanitation and housing. It is the environmental factors. The next one is lifestyle. Diet, exercise, proper sleep, alcohol and smoking. If the person is if the person is smoker, we can tell it is an good healthy person? No, we can't tell. So for the promotion of health, we should avoid smoking and alcohol. Okay, next one is socio-economic status. What is socio-economic status? Income, education, occupation. In the socio-economic state, economically and socially, the patient is okay or not, or the person is okay or not. Then healthcare assess, how we will care the health availability and quality of medical services. Okay, the next one is social support, family, friends and community networks. Our socially support will be there. What are the social friends? Our family will be there, friends will be there, then our community will be there. Community or our placemates are there, so that we are telling that social support. Next one is education, awareness about health practices and disease prevention. This all are the education. Next we are moving for the define oral hygiene. We all know that. What do you mean by oral? Anyone knows? Oral means in mouth. Mouth only we will tell oral. Then how we will hygiene it? For your answer you can tell that how daily we want to brush for twice, in the morning and the night. And the next one is we can apply the mouthwash. For the bad odor we can remove the next one. Then we can explain. Okay. So here the definition of oral hygiene. Oral hygiene is the practice of keeping the mouth, teeth and gums clean and healthy to prevent dental problems such as tooth decay. If the person having tooth decay, we can use what? Tooth decay we can use brushing. Daily brushing we can avoid the tooth decay. Then gums disease, if the patient is having the gum disease, or bad breath. Bad breath means bad odor. Okay, so it involves how we will prevent, how we will continue this oral hygiene by, I already told, not brushing, flossing, rinsing and regular dental checkups. Like that we can maintain our oral hygiene. So next one is, we are moving for the 16th question. What list the purposes of oral hygiene? What are the purposes of oral hygiene? Why we are maintaining our oral hygiene? In our mouth only we will eat the food, so we want to maintain it hygiene. Otherwise we will otherwise it will get other infections. Okay, so we want to maintain our oral hygiene. What are the purpose? What are the purpose now we are discussing? Okay, prevent dental caries. Prevent dental caries. Okay, dental caries, if any tooth decay we can prevent. Okay, so prevent tooth decay. Next one is prevent gum disease like gingivitis. If any gum like diseases, we already discussed it in fill in the blanks. First question we already discussed. So this one is prevent gum disease like gingivitis. Like this infections we can avoid if we are maintaining our proper hygienic person, we can prevent. Okay, next one is maintain fresh breath. So bad breath we can avoid, so we can maintain a fresh breath. We are maintaining, or we are properly maintaining our oral. So next one is promote healthy gums and teeth. We can promote good health, healthy gums and teeth. Next one, improve overall health. So if in our oral is good, means we having the food, it also having no problem. So in overall health, it's also depends on our oral, in our mouth. So improve overall health we can improve. The next one is enhance appearance and self-confidence. If I am standing in front of this camera and I am smiling, so I having that much confidence in my teeth. So you guys having that much confidence or appearance, you also want to make good hygiene. Okay, in oral. Okay, next one, prevent oral infection. We can prevent the oral infection. Next one is ensure comfort in eating and speaking. So it will be very comfort for eating and speaking. So here we are finishing our 16th question. Next we are moving for the next section, true or false. So our first question is, hypothermia is a term used for decreased body temperature. Is that right or not? Yes, it's true, because hypo means it is decreasing. Hypo means it is decreasing. That's why it is known as, that's why it's true. If that is hyperthermia means it will be increase the body temperature. Once more, hypo means decreasing and hyper means increasing. So here hypothermia is a term used for decreasing the body temperature. So that's why it's true. If can I ask one more question? If hyperthermia is a term used for increasing body temperature, it's also true because it's hypothermia, it's for increasing the body temperature. So next we are moving for the 18th one. Temperature regulating center is situated in hypothalamus. Yes, it's also true. It is situated in hypothalamus. Okay, next one is birth weight doubles at the age of 1 year. No, it's not doubles, it's triples. It's triples by 1 year. Okay, it's not doubles, it's triples. Okay, it's triples by 1 year. So this statement is false only because it is written like birth weight doubles at the age of 1 year. Sorry, it's birth weight triples at the age of 1 year means it's true. Okay, so next we are moving for the 20th question. Isolation is the best measure to control infection. Is that isolation is the best measure to control infection? Yeah, it's come true only because isolation is the best measure to control infection. In the COVID time, we were for the isolation purpose only, we survived a lot. So isolation is the best measure. Next we are moving for the short notes. First one is nursing process. What is nursing process? So in this nursing process we having 5 things. What is that? In nursing process is also known as a care plan, because in care plan we were writing assessment, diagnosis, planning, implementation and evaluation. The 5 steps. What all are there? Assessment, diagnosis, planning, implementation and evaluation. So first we are discussing about the assessment. Okay, assessment. What is assessment? Collecting data about the physical and emotional, psychological and social health through observation, interview and examination. Not only that, we were asking the patient present medical history, past medical history, then patient history we were asking. Physical examination, this all are comes under the assessment. Next one is diagnosis. What are the diagnosis of the patient having? Analyzing the assessment data to identify actual or potential health problems. Diagnosis, what we want to diagnose from the patient, that we are diagnosing. Next one is planning. Planning is that setting measurable goals and selecting appropriate nursing intervention to achieve desired outcomes. So planning means we want to achieve goal, to remove the to maintain our patient's health. That is our planning. So proper planning should be done. The next one is implementation. What we want to implement for the patient, carrying the planned nursing intervention to achieve the goal. So here the goal must be the patient want to relieve from the disease or diagnosed disease. We want to prevent from that disease. So here we want to implement. What we want to implement? Nursing interventions like medications, like proper care we want to implement. So that we are coming under the 4th implementation. Next one is evaluation. What is evaluation? Like that last process it is evaluation. Assessing the patient's response to interventions and determining if the goals were met, modifying the care plan if needed. So this all are the evaluation. Next we are moving for the 22nd question, care of terminally ill patient. What is care of terminally ill patient? Terminally ill patients are those with incurable and progressive condition. So what is incurable? It's not cured, and progressive condition, it's coming to progress but it's not complete to progress. Example, advanced cancer and the end stage of organ failure. So it is where recovery is not expected. Here the recovery having no chance. So in that case we were that care we are called as terminally ill patient. It focus on the shift from the cure to comfort, dignity and quality of life. So this all are the care of terminally ill patient. Next we are moving to see more about this care of terminally ill patient. Pain relief. Use analgesic to pain management. We were using pain relief. Then system control, manage breathless, nausea and constipation. This also symptoms control, we can care. Okay, if the person having any constipation, we can make a, if the patient having diarrhea, we can make loperamide medications to the patient, because for the sudden disease we can cure that particular diseases or particular symptom control. Okay, that is the thing. Next one is hygiene care. What is hygiene care? Maintain skin, oral and general hygiene. Next one is emotional support. Emotionally we want to support, because they will not come back from their situation, so we want to give emotional support. What we will give? Provide comfort, reassurance and listen actively. Listen actively. Whose words? That patient's words we want to listen actively. Then we can give emotional support. Next one is spiritual support. Respect beliefs, offer spiritual guidance if needed. Like that, spiritual support we can give. Then family involvement. Educate and support family members. We can also educate and support the family members. Okay, next one is palliative care. What is palliative care? Focus on comfort and quality of life. We can give a proper care for the palliative. Focus on comfort. Palliative care is mainly for the cancer patients. So palliative care focuses on comfort and quality of life. Then dignified death. Ensure peace, privacy and respect at the end of the life. The end of the life also we want to care for that patient. Okay, next we are moving for the 23rd question, first aid for drowning. So this all are the first aid for the drowning. First one is ensure safety before rescue. So first we want to make safety for ourselves before rescue. Okay, next one is remove the person from water safely. Remove the person from water safely. Then next one is check responsiveness, breathing and pulse. In that, before we already discussed about this one, we want to check the pulse and breathing if the patient having any emergency situations. So ABC like that we are discussed like this only. Check responsiveness, breathing and pulse. Okay, next one is call emergency helpline. In this also we already discussed about what is that? Call emergency helpline. In India it is 108. Okay, we can call ambulance or anything. Then next one is start CPR if not breathing. If the patient is not breathing, that means we can give CPR. CPR means 30 compression and 2 breath we want to give. Cardiopulmonary resuscitation. Okay, start CPR is if not breathing, 30 compression and 2 breath we can give. 2 breath in mouth to mouth we can give. Okay, next one is if breathing returns, place in recovery position and keep warm. If the patient is if the patient is very cold in that water, means we can give a proper warmth to the patient. Next, do not try to remove water from lungs by force. We don't want to give pressure or remove the water from the lungs. It's not need that medical doctors will do that one. Do not try to remove water from the lungs by force. Okay, next one is monitor and seek medical attention even if the person recovers. So this all are about the 23rd question. Next we are moving for the next section. Answer the following. 24th one, what is first aid? What is first aid? First aid is the immediate and temporary care given to a person who is injured or suddenly becomes ill before professional medical help is available. We all know that we were traveling for the private buses or anything or the simple vehicles also we need that first aid kit. So you all seen this first aid kit. So it's a temporary and immediate care we were giving from that first aid kit. Okay. Next one is 25. Next question, explain detail first aid for burns. How we were give first aid for the burn patient. If the patient is got burn, how we will care. Okay, first ensure safety, remove from the burn source. If the person is got any burn, please move from the burn source. So that is the first step. Next one, cool the burn. How we will cool the burn? Run the cool water over it for 10 to 20 minutes. If the 10 to 20 minutes we want to cool the burn for 10 to 20 minutes. It's please note 10 to 20 minutes. Okay, next, remove the tight items like rings, watches before swelling start. If the patient having swelling, that in there any rings or watches were there, we want to remove rings or watches. Okay, next, cover the burn. Use clean and non-sticky clothes for dressing. Non-sticky clothes, if nylon, we don't want to use nylon because it also stick the burn. Okay, the cloth will stick the burn. So don't use a nylon polyester like cloth, only use cotton if you preferred. Okay, cover the burn. Okay, next one is, do not apply butter, creams or toothpaste. Do not apply butter, creams or toothpaste. Now we are doing toothpaste. Don't use butter, creams or toothpaste. Okay, do not pop blisters. Do not pop blisters. Blisters also you don't want to use. Okay, sorry guys. Next one is, monitor for shock. Keep the person warm and comfortable. Please monitor the shock and keep the person warm and comfortable. Then last one is, seek medical help for severe or large ones. For the large and severe ones, we want to get the patient to the hospital. So here we are completing our 25th question. Next we are moving for the 26th question. List down the common sites of intramuscular injection. What is that? What are the sites of intramuscular? IM. It's a IM injection. Okay, it is IM injection, intramuscular injection. First one is deltoid muscle. It is upper arm, common for vaccines. Ventrogluteal site, it is hip area, safely and preferred site. Then next one is dorsogluteal site, that is upper outer quadrant of buttock, less preferred due to sciatic nerve risk. Okay. Next one is vastus lateralis, lateral thigh, preferred in infants and children. Rectus femoris, front of the thigh, used occasionally in adults. This you want to get by heart, then only you can understand the terms and the meanings of this one. So you want to by heart it. The sites, the name of the site you must be memorable, or you must be by heart. Okay. Next we are moving for the last question of our section, 27th question. Explain the responsibilities of nurse in administration of IM injection. Verify the doctor's order and patient identity. It is the first step. Verify doctor's order and patient identity. Next one is, perform hand hygiene and prepare sterile equipment. Here sterile equipment means injection only. So prepare a sterile equipment and hand hygiene you should do. Then explain the procedures to the patient, and you want to explain the procedure to the patient, whether the patient want to lay down. We already discussed about the thigh. So in that we want to explain the procedure to the patient. Next one is, select proper site and inspect for any issues. That also we want to care. The next one is, position patient comfortably. So make a good position for the patient. It is the next step, next responsibility of a nurse. Next one is, clean site with antiseptic solution. Next we want to, before applying the injection, we want to clean the site by antiseptic solution. Next one, insert the needle of 90 degree. In IM injection we want to apply 90 degrees. In all the injections having different degrees. Okay, so in this IM injection it is 90 degree. So 90 degree the needle should be inserted medication slowly. Don't take fastly. The medication should be injected slowly only. We want to inject the medication. Next one is, withdraw needle, apply pressure and dispose safely. After we are giving injection, next one is, withdraw the needle by applying pressure and dispose it is safely by the waste management. By the good waste management we want to dispose it safely. Next one is, observe for adverse reaction. Next we want to check, observe for the adverse reaction. Next one is, document medication details and patient response. Next one is, document the medication. If the patient, we are giving the IM injection also, even a small injection also, we want to document the medication and patient response. So till now we had discussed about some important topics from this nursing foundation and the first aid management. I hope everyone could understand this one. For more videos, download Easy Nurse from Play Store or App Store. So we will meet you in next sections. Till then, signing off from Easy Nurse.